Williams. I'm a chiropractor here in Jacksonville. I've been practicing since 2000, and I'm just one of the volunteers putting on the event today. And what we're trying to do is in the community, because a healthy community is a stronger community, and a place that we want to raise our kids and that we want to live. President Bush talked about 1,000 points of light, and that's something I really believe in, that one person living a healthy lifestyle affects the community around them. So with that said, I'd like to introduce our speaker, Robin Williams.
No, Miller. He's dead. Robin Williams is dead.
That was not a proposal. She's going to speak for about 25 minutes, and then we'll have a 5-minute question and answer session now I'm really embarrassed. Dr. Robin Miller currently is practicing internal medicine and serves as the medical director of Triune Integrative Medicine in Medford. She's a medical reporter for KOB5. She's produced award-winning health series, Is There a Doctor in the House?, which is shown on the Wellness Channel nationwide. She's a medical columnist for the Daily Courier in Grants Pass, Oregon, and the host of a teen health podcast sponsored by Nature's Cure. She's been an expert contributor to Women's World and First Magazine. She has a weekly radio show on KISS FM called Kiss Your Health. Robin most recently has co-authored The Smart Woman's Guide to Midlife and Beyond, a no-nonsense approach to staying healthy after 50. She has written the books Kids Ask the Doctor and Confessions of the Soul, Straight from the Heart, and much more. She received her MD from the University of Illinois, and she holds a degree of Master's of Health Science from Johns Hopkins School of Public Health, and is a board certified in internal medicine. And I'm also told she's a very fine dancer. Please allow me to present to you Dr. Robin Miller.
Thank you. It's fine. Whoa. So it's a pleasure being here today. One of the other things I do is I work for ShareCare, which you can find at sharecare.com with Dr. Oz. And so if you miss anything here today, you can always look at my videos. I got all kinds of information on there. So, sharecare.com. It's a great website. So I thought what I'd do is talk about new things that you may or may not know about. So I'm going to talk about vitamin D, folic acid, mushrooms, chocolate, coffee, which is in the back of the room, and it's okay for you to drink it, and some other things that may make a big difference in your life. So let me start with this first, though. So there's this saying in 2000 BC, here, eat this root. 1000 AD, that root's heathen. Here, try this prayer. 1850, that prayer's superstition. Here, drink this potion. 1920, that potion's snake oil. My grandfather was selling it, by the way. Here, swallow this pill. 1945, that pill's ineffective. Here, take this penicillin. 1955, oops, germ mutated. Here, take this tetracycline. 1960 to 2000, 39 more oops, more germs mutated. Here, take the more powerful antibiotic. If you can afford it, 20% of North Americans cannot. 80% of the world cannot. 2001 to now, the bugs have won. Cipro failed, and besides, we can't afford it. Here, eat this garlic. So that's kind of what my talk's about. The more things change, the more things stay the same. So, who is in charge of your body? It's you. Exactly. Almost 80% of disease is related to lifestyle choices. So there are so many ways that you can become healthier, and it's all up to you. You can eat healthier, you can exercise, you can stop smoking if you smoke, you can reduce the stress in your life with meditation or yoga, and have good hygiene. Washing your hands, eating clean food, organic food, and pushing to have cleaner air and water. So what's new? First I'm going to talk about vitamin D, because, and then I'm going to get to fun stuff. So stay tuned. Don't leave. All right. So the U.S. Preventive Task Force said that vitamin D and calcium don't prevent postmenopausal osteoporosis, and as a result, many doctors are telling their patients not to take it anymore, which is ridiculous because vitamin D does many things. It may not help with postmenopausal osteoporosis, but it is wonderful for so many things and essential. So Vitamin D improves balance and muscle function. It boosts the immune system, reduces weight, helps maintain a healthy blood pressure. I can't tell you how many times I've seen people with super low vitamin D that have high blood pressure. I give them vitamin D and then their blood pressure goes down. They don't even need the medicine. Not that I'm saying vitamin D is a good thing to treat hypertension. However, if you do have low vitamin D and you boost it to a normal level, your blood pressure is going to come down. It's also important for long-term health. A study done through the endocrine, there was a study published in the Endocrine Society's journal, and what they found is that early mortality in seniors was significantly reduced in those who took calcium and vitamin D. So how much vitamin D is enough? Well, I generally tell people that it's okay to take between 1,000 and 2,000 international units safely a day. But I check all my patients' vitamin D levels to aim for a level between 40 and 80. Below 40 and above 80 increases your risk for cancer. So it's important to get in the sweet spot. But if you can't get your vitamin D level checked because some of the insurances aren't paying for it now, just take 1 to 2,000 units and that would be okay. It should be adequate. So where do you get it? You can get it from sunlight. But in the wintertime, you're not going to get enough, even if you go out between 10 and 2. And if you go out between 10 and 2, you're going to burn, and the dermatologist is going to get upset with you. If you wear sunscreen, you won't get the vitamin D. So that's why you need a supplement. So vitamin D is in fortified foods and milk, which most of us over the age of 50 don't drink anymore because we have lactose intolerance. My husband being a good example. And it's also found in oily fish, such as salmon and sardines. So, calcium. How much calcium do we need? How many of you are taking over 1,000 or 1,500 milligrams of calcium a day? Okay, well, really you should only be taking 800 milligrams total. When those studies were first done looking at how much calcium we should take, the data was misinterpreted. The safest amount is 800 milligrams a day. Above that, you run the risk of the calcium depositing out in places you don't want it to go. So it's best also to get it from food, and it's really not that hard. If you drink milk, there's 300 milligrams of calcium per serving. Mozzarella cheese, 330 milligrams per serving. Low-fat Swiss, 240 milligrams per serving. And vegetables, if you eat tons of vegetables, kale has 90 milligrams per cup, broccoli 42 milligrams per cup. So when you add it up through the day, you're probably getting enough, and you probably don't need any extra calcium. The other thing calcium will do if you take too much is it'll constipate you. I had this patient, she was so constipated, and I made her bring her supplements in, and when I added it up, she was taking 4,000 milligrams of calcium. It's insane. So, watch what you're doing. If you do need a calcium supplement and you're on something like Prilosec, which blocks acid, you need calcium citrate because calcium carbonate will not be absorbed. It needs acid. So let's talk about folic acid. Folic acid's been found to reduce birth defects. Come on in! Hey guys! In pregnancy. It's also been found to reduce first-time, you can sit in the front row, it's okay. First-time strokes in women, but it's also been found to increase the risk of cancer, and I'll explain that in a minute. So when you take folic acid in your diet, a series of enzymes in the small bowel works on it and turns it into L-methylfolate. L-methylfolate is what your body uses to make serotonin, dopamine, and norepinephrine. So if you, for some reason, cannot do that, then you may have lower dopamine, serotonin, and norepinephrine levels. So we have genes that modulate this. The gene is MTHFR. Cover your ears, girls. I call it the motherfucker gene. That way you'll remember it. So MTHFR. So if you have mutations on that gene, if you have one mutation, then your L-methylfolate levels may be reduced by 30%. If you have two mutations, it may be 74%. So what can you do? This is connected to depression, IBS, sleeping issues, low energy, and so what you can do is something very simple. You can take L-methylfolate and bypass that mechanism. So L-methylfolate may help with your IBS because what people don't realize is the gut is lined with brain cells that make serotonin. So if you're having problems making serotonin, then you give L-methylfolate, that may actually help your irritable bowel syndrome. It may help you sleep, may help your mood. When you take antidepressants, the SSRI antidepressants like Zoloft, Paxil, Prozac, all they do is they help your brain be bathed in the serotonin that you already make longer. What this actually does is helps you to make serotonin. So it can be amazing. Now, some of the genes are connected to Alzheimer's, heart disease, and all kinds of bad problems. So you can actually negate that by taking L-methylfolate if you're one of those people that has the mutations. So all you need to do is ask for the blood test from your doctor, MTHFR. It's approved by Medicare. It's approved by most insurances. There's one that didn't pay for it. Sorry about that. But you might want to check before you have them do it if you have insurance issues. If you're paying out of your pocket, you can get it at Rogue Valley Medical Center for $150. Let's talk about, let me talk about the cancer risk for folic acid. So there has been an increased risk of cancer for using folic acid supplements. And the reason I think it is, this is my own theory, and I've talked to other people who kind of semi-agree with this, is if you have the mutations and you're not able to process folic acid, well, where does it go? It just sort of stays there. And then you have some abnormal cell growth in your body. Well, that can use your folic acid. So I think that's why there's an increase of rate of cancer in people who are taking excessive folic acid supplements, because I think if they're the people that can't process folic acid, the cancer will, even though they can't. Does that make sense? Yeah. Okay. So that's why you shouldn't take excessive amounts of anything, but also you might want to check your MTHFR levels, because 85% of Americans have at least one mutation. I maybe have 10 people who are normal in my practice. So speaking of possibly in curing it, and those are mushrooms. Not the kind from the 60s. These are medicinal mushrooms. So what mushrooms do is they take bacteria, silt, and toxins from the environment, and they clean everything up. If you see what mushrooms do to toxic waste dumps, it's miraculous. They'll clean them up in a year. So mushrooms are actually good for our body, as long as you can take them. They boost cancer-fighting cells. They have antiviral and antibacterial properties, and they can protect from flu, West Nile virus, and they have good fiber and are overall just good for you. Now, some people get diarrhea from them. If you're one of those, don't take the mushrooms. So I'm going to talk about some specifics. Turkey tail. Looks like a turkey tail. It's used as chemotherapy in Japan for breast cancer. There they give it IV, but we have potent capsules here that you can take orally, no problem. It's effective against HPV and HCV viruses, so it helps with preventing hepatic cancer for those with hepatitis C, and cervical cancer for women who have HPV, which we're going to talk about in a little bit. It's anti-inflammatory and it boosts cancer-fighting cells. And I'm going to tell you where you can get these in a minute, but it's pretty amazing. Cordyceps. They develop on insect larvae. Looks really gross, but they're really good. They're used as a tonic to increase energy. They increase libido, and they may lower cholesterol, although I've tried it in patients and I haven't gotten great results. Maitake mushrooms are, I'm sure you've eaten them. They're packed with antioxidants, B vitamins. They taste really good. They kill HIV in culture. They're antiviral. They boost cancer-fighting cells, and they help nausea post-chemotherapy. Lion's mane, very cool mushroom. I've never seen it, in the wild, but it looks really awesome. It supposedly tastes like lobster. It contains 20% protein, promotes nerve growth, improves memory, improves mood, and adds a sense of well-being for menopausal women. So y'all might want to rush out and get this one. So the mushrooms are available in capsules. There's a company that I recommend because I know it's good. And knowing what mushrooms do, pulling toxins from the environment, you want to make sure you get organic, certified organic mushrooms, because you don't want to get them in the process of where they're changing the toxins over. So there's a company called Host Defense. They have My Community, which is a blend of 17 mushrooms. They have the turkey tail, cordyceps, maitake, all of them. At Wellness Compounding, they have these mushrooms. You can also get them at Shopping Cart in Ashland for less money. So if you want to drive to Ashland, you can find them a little bit cheaper. But I recommend them for anybody who's had a history of cancer or would like to prevent cancer, like if they have a family history of breast cancer or a family history of melanoma. So what I usually recommend is they take 2 of the My Community in the morning before breakfast, 2 of the Turkey Tail before dinner. So as I said, the My Community is a blend of 17 mushrooms. So I had a patient who had something called Merkel cell tumor. It was a very weird skin cancer, very rare. So she had a biopsy, and then I started her actually on the lion's mane because she had back pain, and I thought maybe it would help the nerves in her back. And I totally forgot about it. A couple months later, I get a phone call from the doctor, this Merkel cell doctor expert, there's only one in the country, up at University of Washington. He goes, "What did you do with this patient?" And I went, "Nothing." And he goes, no, he goes, "I did the biopsy. 2 months later, when I took the tumor out, all the cancer cells were dead. What did you do?" And I said, "I gave her lion's mane." And he said, "Wow." And they found actually that these mushrooms are the only things that work in metastatic Merkel cell tumor. And he ended up starting a study. It's ongoing right now at the University of Washington, looking at lion's mane, turkey tail, and the My Community for Merkel cell tumor. So fortunately, because I did that, I got to talk to Paul Stamets, who's the guy who's the owner of Host Defense. For me, he's like a rock star. It's like, oh my God, I'm talking to Paul Stamets on the phone. Anyway, I talked to him, and he told me that he told me the story about his mother, and then his mother's 90 years old. She lives out in the middle of nowhere. She's like this pioneer woman. Finally, someone goes out to see her, and she's got this huge breast tumor. And they brought her to the doctor, who said, "There's nothing you can do. Tell her to get her affairs in order. That's it." So he started her on 4 My Community in the morning before breakfast, 4 Turkey Tail before dinner, and her tumor is now gone, and she's still alive. Wow. So I'm not saying that this is something you should do alone, but I'm saying that in cancer, viral illnesses, it's not a bad idea to do it in addition to, and it's considered food. It's medicinal food. So it can be taken along with chemotherapy, radiation, whatever. Just a thought. So you might think, well, what about the mushrooms that you see on the shelf at the store? The button mushrooms, portobello mushrooms, well, they're carcinogenic. So number one, you want to get them organic because, as I said, you don't want to get the mushrooms as they're pulling the toxins out. So get them organic, and you must cook them. Don't eat them raw.
That was the bad news.
Okay, so as I said, the best time to take them is before meals, and twice daily if you're going to do 2 different kinds. So chocolate. It's been used for thousands of years for medicinal purposes. It lowers blood pressure, lowers LDL cholesterol, increases serotonin, increases endorphins. It's a great cough suppressant. So if you get a cough, you take a little square of chocolate and you let it melt on your tongue, and your cough is gone for an hour. It works. It also improves cognition. So they did a study in seniors at Harvard, and they found that the seniors who drank 2 cups of hot cocoa a day for 1 month performed better on thinking and memory tests than those who didn't. Brain imaging also showed an increase in blood flow on those who had a blood flow problem to begin with. If they didn't, it didn't matter, but they were a lot happier because they were drinking chocolate.
What kind of hot chocolate? Like, you have to
It has to be, oh good, nice segue. Very small amounts adequate, and it has to be at least 65%, so dark chocolate. Although there was a study in Scandinavia where milk chocolate actually did do some good things, but I'm not saying. And white chocolate as well, but dark chocolate is the preferable one. And obviously moderation is the key because it's fattening. So what about coffee? I love coffee. So I'm always looking for reasons why I should drink it. So many years ago, there was a study about coffee showing that it increased the risk for pancreatic cancer, which is why doctors were having people stay away from coffee. But that was a long time ago when people didn't think about other things that went along with drinking coffee. So what they found is the coffee drinkers actually were smoking. And it wasn't the coffee at all, it was the smoking that was increasing the risk for pancreatic cancer. So actually, coffee does not cause cancer. It does do a lot of very good things though. Coffee drinkers compared to non-drinkers are less likely to have type 2 diabetes, Parkinson's disease, and dementia. They have fewer cases of certain cancers, heart rhythm problems, and strokes. And women who drink 3 to 4 cups of coffee a day, especially postmenopausal women, are less likely to have tinnitus or ringing in the ears, which is a really horrible thing when you have it. So if you don't have it, keep drinking your coffee. With coffee, moderation, of course, is the key, and it's associated with reflux disease. So if you have reflux, you might want to either take your Prilosec and then drink your coffee, or stay away from coffee. It can slightly increase blood pressure in the beginning, but if you drink a steady amount all the time, it's not going to do anything to your blood pressure. The other thing is it's addicting, and withdrawal, it can give you just a wicked headache. But other than that, you won't be as happy and you won't think as well, but that's okay. Okay, let me talk a little bit about lemon balm. This is very cool. Lemon balm kills herpes virus. So I don't know, how many of you get cold sores? Okay, so lemon balm will decrease the amount your cold sore will last, but if you use it every night before you go to bed, you probably won't get a cold sore. It's very cool. So there's some studies that suggest that topical ointments containing lemon balm may help heal cold sores caused by the herpes 1 virus. And in one study, 116 people with herpes virus who applied lemon balm cream to their lip sores experienced significant improvement in redness and swelling after only 2 days. Of course, they did still scab up. But there was another study that showed that when people had a first-time infection, lemon balm, they used lemon balm, there was no recurrence. Yeah, so they had one infection and then never any again. These were 3 German hospitals looked at this. And the Germans know how to do studies. So, okay, now I'm going to talk about the V word. So, men, if you don't want to hear the word vagina, you can put your hands over your ears. Or you can just step out for a minute. Okay, good. You guys are all brave. Okay, so you mentioned HPV to a woman, they freak out. So I have something very cool to tell you about HPV. So HPV, or human papillomavirus, is the cause of cervical cancer and certain anal cancers and throat cancers. We now give young girls, and they came up with a cream. They call it Vacurin. And it worked. It worked in getting rid of the local HPV and cervical dysplasia. Unfortunately, no drug companies picked it up because it's not very expensive to make. So for people with high-grade cancers, they were giving them IV curcumin, which was also very effective. So I took that study and I showed it to Angie Meeker at Wellness Compounding, and we now have our own curcumin suppositories for HPV. So if you know anyone who's having an abnormal pap smear that wants to see if they can eradicate it with something natural, curcumin would be the way to go. And we have the suppositories now at Wellness, and they're not expensive. In fact, for now they're free, because we're trying it out on people. So if you know anyone that's worried about it or has it, this would be a great solution. As far as their partners go, I would give them, yes, I got 5 minutes! Okay, I'll talk fast. I would give them oral curcumin, which you can find online. Really good quality. Okay, so for menstrual cramps, you know anyone with really bad menstrual cramps? We've got a treatment for that too. It's Viagra. Really. So Viagra, it opens up blood vessels. And actually the Viagra is really good for vascular things. And the way they discovered it helping men was that it was actually used in babies, premature babies, to help with their lungs. And they noticed when they gave Viagra to these babies, the male babies, that they would have erections every 2 seconds. And that's how they came up with the idea of using Viagra. So Viagra actually opens up blood vessels, and when you give it to women who have bad cramps, it just stops the cramps. And nothing else happens. They're not having light clothes or anything weird like that. There's basically no side effects. So it's really effective, and you know, it's not expensive. We found a way to do it that's not expensive. So if you know anyone, again, Wellness Compounding will have it. And it was actually studied at Penn College, so and it really works. Okay, so one more thing, Viagra for women. Why should men have all the fun? We actually have Viagra for women, and I get nothing for this, by the way. It's just the Wellness Compounding is really cool.
blood vessels. You put it on an hour before you're going to do whatever you're doing. Bingo, you're 16 again. It's really fun. Just a thought. Okay, one more thing I want to talk about, and that is genetic testing. So I've been doing quite a bit of genetic testing. And testing in that I look at how people process medications. So we have genes that help process different medications in the liver. There's so many of them. And so I can look and tell you about your enzyme levels in your liver and tell you which medications are going to work and which ones aren't going to work. So for example, how many of you have ever been given Vicodin? Okay, how many get sick from Vicodin? Okay, so you probably you have a slow enzyme that doesn't allow you to process the medication. So you can't cleave off what needs to be cleaved off to make it effective, and all it does is make you sick. I'm one of those. So that in addition means that there's certain statin drugs that you can't take that will make you hurt and won't be as effective as others. So it's good to know if you're going to take a statin drug, which one's going to work and which one's not, and which one's going to make you sick. Same thing for anesthetics. I can tell you which anesthetics, genetically, you can process, which ones you cannot. And it saves some of my patients an amazing amount of grief. Antidepressants, that's the best thing. So if I think someone needs to be on an antidepressant, usually in the past it was a crapshoot. Which one should I choose? Well, let's try this one. Oh no, this isn't working. This is making him sick. This has side effects. Well, I can tell you by genetically testing you which antidepressant is going to work for you and which one isn't. This is especially important for children, I think, because we don't want them to, you don't want to experiment on kids. And my experience with it has been amazing. Susan, would you say too? Susan uses it too. Pretty incredible. So, and it's not, and actually Medicare pays for it, Medicaid pays for it, and now most of the insurances are paying for it. The one I use is called GeneSight, and it was designed by Mayo Clinic. Incredibly effective. So, the bottom line is, it's the little details that are vital. Little things make big things happen. Take care of the small things, and how wonderful it is that nobody need wait a single moment before starting to improve the world or themselves. So, I did it! Okay, so any questions? Yes?
So, in terms of the mushrooms,
Yes.
is there quite a lot of information about that on the internet?
Yes.
The ones that you have talked about? Okay,
Yes.
so I can just-
Stamets has a lot of information. There's a lot of information out there. Yes?
Are those available at wellness pharmacies?
Yes.
Or you go?
Wellness and shopping cart. And online. You go to Fungi Perfecti or fungi.com.
For those of us who missed this presentation, do you have it online somewhere or in paper form?
I don't, but you know what? You can come hear it again.
When is it?
November 15th, I'm giving a talk for AARP, and actually it's going to be more. There's something really cool that I'm going to add to it.
What day was
It's at Smolin Center, November 15th.
At where?
Smolin Center, November 15th. Smolin. Yeah, it's with the AARP, and I have something very cool. And it has to do with Alzheimer's disease. And I just didn't have enough time to talk about it today, plus I have more information. Yes.
What's the brand name for the mushroom?
Post defense.
Post Defense.
Yeah.
The genetic testing, does that work with allergies too?
No. Sorry about that. But there is allergy testing for that. There's, depending on what kind of testing you want. There's a blood test for food sensitivities or allergies. Any other questions? Yes.
On the genetic testing, if you had genetic testing 8 years ago,
Yes.
would all that, like, they could send the results?
Oh, yeah.
And all that other information?
Oh yeah, and it's the same because your genes don't change.
Okay.
Oh, Wellness is on Crater Lake Avenue. I don't know their address, but I can give you their phone number.
1150.
Oh, 1150. 1150 Crater Lake Avenue.